Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's December 2025 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled "Social Isolation is Associated with Peripheral Endothelial Dysfunction." It is authored by Dr. Jaskanwal Sara and colleagues from Mayo Clinic in Rochester, Minnesota. Endothelial function is critically dependent on the bioavailability of nitric oxide, the latter generated by endothelial nitric oxide synthase. Nitric oxide, so generated, regulates vascular tone by enabling vasodilation, maintains the endothelium in a relatively quiescent, non-inflamed and non-thrombogenic state, and is indispensable for adequate tissue perfusion. When nitric oxide bioavailability is compromised, either because of a decreased production, increased consumption, or resistance to nitric oxide, endothelial dysfunction arises. Endothelial dysfunction promotes vasoconstriction, vascular inflammation, and cell proliferation, a prothrombotic state, and the formation of vasculopathic lipids. For the vast bulk of cardiovascular diseases, endothelial dysfunction is involved either in the initiation or the progression of such diseases. Sara et al. Questioned whether social isolation is associated with peripheral endothelial dysfunction. The premise for their study resided in their prior observations that social isolation predisposes to accelerated aging, and that such aging associates with peripheral endothelial dysfunction. The premise for their study resided in their prior observations that social isolation predisposes to accelerated aging, and such aging associates with peripheral endothelial dysfunction. Undertaken between January 1, 2018 and December 31, 2021, the present study assessed peripheral endothelial dysfunction by reactive hyperemia peripheral arterial tonometry in individuals who completed a social determinants of health survey, the latter including questions pertaining to social isolation. The data derived from over 300 individuals demonstrate that peripheral endothelial dysfunction was present in almost 30%. Compared with individuals with no social isolation, peripheral endothelial dysfunction was significantly present in individuals with moderate or severe social isolation. The association between social isolation and peripheral endothelial dysfunction persisted after adjustment for conventional cardiovascular risk factors. Sex-based analysis demonstrated that the association between social isolation and peripheral endothelial dysfunction applied to women but not to men. As regards potential mechanisms, Sara et al. Point out that social isolation predisposes to a number of factors: anxiety, depression, unhealthy lifestyles, lack of physical activity, smoldering inflammation, all of which may impair endothelial function. They also point out that as women tend to have fewer cardiovascular risk factors compared with men, they may be more vulnerable to the adverse endothelial effects of psychosocial stress as imposed by social isolation. Finally, as the association of social isolation with endothelial dysfunction was independent of and appeared stronger than traditional cardiovascular risk factors, Sara et al. Persuasively argue for the inclusion of social isolation in cardiovascular risk stratification. Endothelial dysfunction is one of the salient pathways that underpin the instigation and development of cardiovascular disease, and these original findings of Sara et al. Uncover a novel determinant, social isolation, of this hallmark of cardiovascular disease. Our first highlight article is an original article entitled Social Isolation and Burnout, Professional Fulfillment, and Suicidal Ideation Among U.S. Physicians. It is authored by Dr. Colin West and colleagues from Mayo Clinic in Rochester, Minnesota, and colleagues from the University of Colorado, the American Medical Association, and Stanford University. Burnout is higher in physicians than in other members of the workforce and is caused by such factors as severity and duration of workload, loss of autonomy, the electronic health record, administrative burdens, and the challenges in the current landscape of healthcare, among other considerations. In the present study, West et al. Questioned the effect of social isolation on physician well-being. These investigators undertook a survey of U.S. physicians between November 20th, 2020 and March 23rd, 2021, in which social isolation was evaluated using the PROMIS 4-item social isolation scoring system, and professional fulfillment and burnout were assessed using standardized instruments. The PROMIS 4-item scoring system asked the respondent to rank on a 5-point scale their own perceptions regarding how aspects of social isolation apply to them. The total numerical score is then converted to a T-score by a conversion table. The greater the score, the greater the feeling of social isolation. West et al. Observed that social isolation was higher for women than men physicians, unmarried physicians, and for early and mid-career physicians. Compared with physicians in the best quartile social isolation group, physicians in the worst quartile isolation group exhibited markedly higher percentages for overall burnout, lowest quartile professional fulfillment, and suicidal ideation. For each 1 point higher social isolation T-score, burnout was increased by 10%, lowest professional fulfillment by 11%, and suicidal ideation by 9%. Compared with workers in other fields, physicians had a significantly higher likelihood of reporting the feeling of social isolation. These important and timely findings by West et al. Point to social isolation as a significant factor that impairs physician fulfillment and well-being, and, as discussed by West et al., this may be addressed by several strategies. Finally, one cannot help noting that social isolation may exert a catalytic effect on burnout, namely, the duration and magnitude of the physician workload predisposed to burnout as well as social isolation. And social isolation, as it develops, in turn, further exacerbates physician burnout. Our second highlight is an original article entitled Interplay of Social Determinants of Health and Traditional Risk Factors in Predicting Cardiac Aging. It is authored by Dr. Nazanin Rajai and colleagues from Mayo Clinic in Rochester, Minnesota. In the United States, cardiovascular disease is the predominant determinant of morbidity and mortality. Cardiovascular disease, as for diseases in other organs and systems, tend to accrue with age, and such comorbidities compromise health span. The recognized distinction between lifespan and health span has emphasized the difference between chronological and biological aging. The former is readily definable because it represents the number of years lived, whereas the latter is more challenging as it broadly reflects years of relatively preserved physiologic processes and accompanying functionality. Seminal studies at Mayo Clinic introduced and validated the artificial intelligence AI enhanced electrocardiogram ECG to estimate cardiac aging and to determine the cardiac age gap, the latter calculated by subtracting the chronological age from the AI-enabled age estimate. A positive gap indicates accelerated aging. Rajai et al. Questioned the role of social determinants of health and traditional risk factors in predicting cardiac aging. Their study involved a cross-sectional analysis of more than 280,000 adult patients receiving medical care at Mayo Clinic between 2018 and 2023. Social determinants of health, physical activity, stress, social connection, financial strain, housing instability, education, food insecurity, nutrition, and transportation needs were all assessed by a questionnaire. The medical records provided demographic data and data pertaining to the presence of cardiovascular disease risk factors, hypertension, diabetes, and smoking, and assorted relevant comorbidities. Compared with comorbidities and demographic factors, social determinants of health exerted the greatest impact in predicting the cardiac age gap in the total population and in sex-stratified analysis. Financial strain and food insecurity were the most influential of these determinants. Using Cox proportional hazard models to perform survival analyses, there was a strong association between the various components of social determinants of health, especially financial strain and housing instability. Indeed, in predicting mortality, the hazard ratio of some of these equaled or exceeded biological comorbidities such as myocardial infarction or risk factors such as smoking. Important conclusions from these novel and timely findings are at least threefold. First, they demonstrate another unique application of the AI-enabled ECG in assessing cardiac aging. Second, by demonstrating that accelerated cardiac aging and accompanying mortality associate with social determinants of health as significantly as they do with traditional risk factors, these findings uncover a little appreciated non-traditional determinant of such aging and mortality. Third, these findings have significant societal implications for preventive policies that seek to address these important healthcare issues. One of the central themes of the international bestseller *Sapiens* by Yuval Noah Harari is that Homo sapiens, compared with other species, assumes singular dominance by recognizing the importance of and utilizing social networks. Ironically, in our current digital age, where the opportunities to communicate are vastly greater than in any other age, social isolation is a phenomenon of current mounting concern. Indeed, the U.S. Surgeon General's 2023 advisory on our epidemic of loneliness and isolation highlights this issue and its adverse effects on our health. As noted in this advisory, social isolation has increased in young adults yearly from 1976 to 2019 and is as harmful as smoking 15 cigarettes per day. This editorial highlights this issue by demonstrating the adverse effects of social isolation on endothelial function and on physician well-being, and how accelerating aging and mortality may be linked to specific components of social determinants of health. While the clinical impact of such societal risk factors may not be intuitively obvious or clearly discernible, such studies as reviewed in this editorial assuredly show that they are, and that such societal issues merit much greater consideration than what they currently receive. You can access these highlights and Editor's Choice articles free of charge during the entire month of December. We invite you to visit our Mayo Clinic Proceeding website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find access to our social media by clicking the links to follow us on YouTube, Facebook, and X under the media icons in the center of the homepage. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Please check out our Pioneers and Legends feature for interesting conversations with leaders in the field. Our homepage also includes a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 Centennial Celebration and our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are also available through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.